Hey you guys, so it is the day of surgery. I have had it done, obviously, as you can see. I had it done I've got in at 7 AM, I was operated on at 8 o'clock and I am now home and it's 10:30. So absolutely love having this done by local anaesthetic. I would have been way more nervous if it was general. In fact, I don't know if I'd have gone through with it, to be honest. And I could tell what would have gone on with general anaesthetic because there was a lot of checks and whatnot that they were like, oh no, that doesn't apply to you because you're local anaesthetic, you know. And even the nurses were saying it's much better under local, it's much less, there's less risk, you know. One of the things I was concerned about was how he was going to keep my eyes from blinking or from moving whilst having a scalpel near them, because when I had that consultation at Transform, they only did it under general anaesthetic because she said it's by your eyes and so we don't want the risk of your eyes moving. And so I was a bit concerned about that, but he was talking to me all the way through and telling me exactly what he was doing. And the way that he stopped it was he was actually holding the skin. And so my head was in a kind of, right, let me start from the beginning. So I walked through to theatre, which was great. It's really odd being in an operating theatre awake though, you know, especially at the end when you hear them counting all the scissors and, you know, that kind of thing. But anyway, walked into theatre, got up on the bed, they cleaned my whole face and then they sort of mummify you, if you like. You know, I had a blanket over me. They made me put my hands inside and they were sort of trapped against the edges of the bed because they don't want you bringing your hands up. But the nurse was just holding my hand, bless her. And she was sort of holding it all the way through. And she said, it's just to stop you bringing your hands up as a kind of reflex to your eyes. And then what they do is they put a cover over everything except for your eyes. And then they tell you that you're going to have really, really bright lights, like 2 inches from your eyes. And I have to say that was pretty intense. It's not like, you know, the lights we've got going on here, it's bright lights that would blind you. So they cover one half, but the other half, obviously they need the light in. So they cover one, they then put the anaesthetic in, which is the most painful part. And this is the bit she was like, oh, this is a bit uncomfortable, but just squeeze my hand, you know. And this side was absolutely fine. He did this side first and this side wasn't a problem at all. And then he did this side and the first one going in was actually quite painful. It felt like it was going in my eyeball, to be honest. But it's no different to having Botox, you know, and I'm sure everybody watching has had anaesthetic for something at some point. It's not unbearable. Then obviously he waited, he went and scrubbed up. I'm just noticing there's a little bit of skin there and I'm already like, oh, there's a bit of skin. He didn't get that bit of skin. That side I can see that there's less. But just see when I'm like, huh, could you not have taken more up there? I'm going to be that picky person that's like, I want it done again. So then he just started working and, you know, he checked that I couldn't feel anything and I couldn't at all. He then said, he asked for scissors and I kind of thought, well, I wish I didn't hear that. He's obviously now going to snip the skin off, and then I could hear him snipping the skin off. I could hear him cauterising it. He told me to be quiet and still throughout the procedure and it was completely silent in the theatre. It was weird because we were all very chatty before. I was having a laugh with the nurses and then it's just like completely silent throughout. And yeah, so I heard him cauterising it and then I could feel him stitching it. You could just feel the pressure. The weirdest bit was when he's pulling, because he obviously pulls up the skin to cut it, and I could feel that, but what I could feel or what I could see was just flashes of light. I could feel that he was pulling my eyelid open and I could just see these flashes of light, which was obviously the lights right on top of my eyes. Then he did the other one and I went back. I mean, I must have been in there 30 minutes maximum, you know. It just wasn't very long at all. The time we got to the second one, he actually started talking towards the end of it and said, oh, I'm just stitching you up now, and everybody started talking again, so it was absolutely fine. Got back to my room. And me being impatient, I just kept going and asking them when I could leave because I was ready to go. They'd asked me if I wanted to order food and I was like, no, I don't want food, I just want to go home. I took my painkillers at that point because I wasn't sure if I was supposed to take them in the morning. So I was starting to get a headache and my joints were really sore. So I've at least got pain relief in my system already. They do feel a bit painful, I have to say. They feel a bit painful just on the edges here, and they actually, both sides have been bleeding a little bit just from here. There's just been getting little drips of blood coming down, little trickles, which I just pat away and then it seems to stop. But yeah, they do feel a little bit painful, but only a little bit, not anything that would, you know, stop me doing anything. But I do wonder what would the pain be like if I hadn't taken my usual daily painkillers, which is codeine, you know, codeine and paracetamol. What else? I can't shut my eyes. Like if I try to shut my eyes, they probably look like they're shut, but they don't completely shut. And I said that to him, and he said, well, he said it's trying to find that place between taking enough skin and, you know, allowing your eyes to close. He said, but at the minute they'll start to be swollen and whatnot. So for the next week, I may have the problem of not being able to completely close my eyes. Oh, I think a little bit of brow stuff might have come off while I was doing that. I am going to put some lip balm on my brows, and that's a bit odd, but I haven't. You know, I'm supposed to be putting that Aquaphor on them, which is pretty much like lip balm. It's used for lips, isn't it? Since I left this morning at 6:15. So we're going to get some on. Just said that it's because these brows are to be moist healed, whereas this isn't. I'm to leave these Steri-Strips on now for a week. And then I've got an appointment in a week to go back and have the stitches and the Steri-Strips removed. So underneath this, there is one stitch that literally goes from there to there, and he just sewed along it, just one stitch. They just pull it out like that next week. So yeah, I am really curious to see the results. I'm not looking forward to the next week because I can feel at the minute that it's going to be annoying having these Steri-Strips there. Oops. Already just touched that and that's bleeding now. I feel like if you just knock them, it starts bleeding, you know, and it's actually quite itchy. It feels really itchy. I could really, you know, scratch my eyes a lot. So, but I've just got a funny feeling that these Steri-Strips are going to be really, feel like I want to rip them off, you know, just like an old plaster. But I'll just have to put up with it. Nothing specific I need to do other than they did give me these, which are just swabs, you know, just pieces of bandage. And she said if your eyes are sore to put cold water on them, so to just take one like so, put cold water on it, wring it out, and then just, you know, put it on my eyes, and that things like ice and that will help with the swelling and the pain. So that's really all I've got to do. I'm going to edit this video and get it up for you, and then I'll just keep on posting little videos as and when I can, because I know you said, when I asked you, you said it was easier or better for you to see it as I went along rather than saving it all for one big video. Before I go, I'll give you a close-up, because I can already see, like I said, that when my eyes are relaxed, there's still, you can see a little crinkle of skin there, but I think that that's probably because the Steri-Strips are there, if you know what I mean. It's sitting on top of the Steri-Strips, so when you take that off, hopefully that will all smooth out. There's just no way of telling what it's going to look like just now, but this is what it's like close up. So I will see you again in a day or so. Good morning, you guys. It is now day 2. So I thought I would pop in and show you what's going on and kind of give you a little update. So the Blepharoplasty, the eyelid surgery was yesterday. And so last night was my first night, and I was a bit concerned how I was going to sleep because I've got Steri-Strips on top of the stitches, as you can see, and they come quite far at the side of the eyes, and I'm a side sleeper. And it would, of course, be better if I slept sort of sitting up, but as the nurse said to me, they don't tell you to do that because everybody ends up in the position that they're naturally used to sleeping in, and that's true. You know, you can start that way, but you'll end up turning over anyway. And I don't like sleeping with more than one pillow, so I just slept on one pillow, and I thought, you know what, if I have more swelling, I have more swelling. I need to get a good night's sleep because that's also restorative. So I had no problem at all sleeping. I guess I was sleeping sort of like that, you know, so that I was sleeping on the edge of the pillow so that I wasn't disturbing these Steri-Strips, because like I said, these have got to stay on for a week. The only thing was, yesterday throughout the day, I've had a bit of bleeding from separate places. So one, you can see there because it's come through the Steri-Strip. Then this side was bleeding a little bit, and then it was bleeding a little bit from here. It's really weird. You can suddenly just feel that your eye's a bit wet. And so I think what happened last night is it was bleeding here, and it kind of came all under my eye. And when I woke up, that was all dry, and it meant that it was quite difficult to open the corner of my eye. So when I woke up, I actually thought that my eyes were really swollen. But when I had a look, it was just, like I said, all this dried blood. So I had to clear that from all the way underneath my eyes. And I don't think they look too bad at all. I really was expecting and was told that I would have black eyes today, and that all under here would be black completely. And I am a bruiser, you know. She asked me if I was a bruiser, and I was like, yeah, I bruise like a peach, you know. So I totally expected to be sort of black-eyed the whole surrounding bit, but it's not at all. I can see that my whole eyelid is bruised, like the very little bit of my eyelid that's showing at the bottom of the Steri-Strips is bruised, and kind of to about where that nail is bruised there. But I mean, that's a lot less than I was expecting. It's a lot less inflamed. I haven't done anything. I have in the past used arnica, but I thought, you know what, bruising is it's a natural thing. It's the body's way of dealing with something. It's not painful unless you touch it. It's not unnatural, and it's not going to cause me any problem. It's not like I can put makeup on anyway, and so I thought I'm just going to let myself naturally heal, if you like. So I haven't done anything. I haven't used the cold compresses. I have barely any pain, and it's not the painkillers. And I can tell you that because I can take up to 4 doses of my full pain medication, which is codeine and paracetamol, but I generally only take 3, sometimes 2, and occasionally 4, depending on the level of pain I'm in. And so I had thought last night, I had taken my 3 doses, and I thought last night I would probably be in pain and need to take the 4th dose for eye pain, but it wasn't painful at all. And so I didn't take any painkillers. The last painkillers I took was yesterday afternoon at about 4 o'clock in the afternoon. Didn't have anything, slept absolutely fine, woke up and with my eyes wasn't in any pain at all, even before I'd taken my morning painkillers. So I'm really surprised at that, because you know, it's that Blepharoplasty treatment I had for hooded eyes was more painful than this, way more painful. Like afterwards, I remember Kev and I went for a pizza and I was sitting there saying to him, I just can't bear this pain. That hasn't been the case with this. This feels uncomfortable and it feels tight. And if I sort of go to move my eyes, ow, that's a little bit painful, but it's a little bit painful, you know, if I move my eyes a certain way, and that's it. Other than that, I just don't feel, I'm just getting on with things as normal. Yesterday I cleared out my cupboards because I've done so much filming already. You know, I've got not loads of spare time, but I've got a bit of spare time today. I'm just going to do the grocery order online, then I'm going to finish clearing out the cupboards. I'm going to edit some of the videos that I've already recorded and whatnot. Yeah, I'm certainly not going to be lying around with compresses on my eyes. Like I said, I didn't use the compresses at all because they just didn't feel swollen, didn't feel painful, and I didn't want to be sitting there with something on my eyes. The only thing, I suppose, I did have a moment of concern yesterday in that I was tired because we did get up very early. I had to be there at 7 o'clock, so we got up at 5:30. And I did feel like I couldn't close my eyes. Remember I said to you I can't close my eyes properly? And I was trying and I couldn't close my eyes. I did go and lay down yesterday, actually. I lay down for about half an hour and I managed to close my eyes, and it was in the bedroom. But then later on I was sitting on the sofa and my eyes just felt a bit uncomfortable, and I was trying to watch TV, but actually that was hurting them, but I then couldn't manage to close my eyes. But it's because the light was on. I think I can close them now with the light on. Yeah, they obviously were a little bit more swollen yesterday because, like I said to Kev, oh God, this is annoying. I can't watch TV because it was making them a bit, you know, just when your eyes get really tired and sort of gritty feeling. And I wanted to close my eyes and just sort of lie there for a minute, but I couldn't close my eyes. But like I said, Kev switched the light off and I could close them and it was absolutely fine. And so, yeah, that's gone away. No problem with that at all. So really happy with my progress. Not much more to tell you today. I will come back if anything changes. I'll come back whenever it does. If not, I'll come back in 2 or 3 days and show you how it's going, and then I'll come back and show you what it's like when the stitches are out. I'm dying to see what it's like. You know, I'm trying to look and see, can I see any difference? But it's so hard to tell because, like I said, there is that bit of skin sitting on top of the steri strips, and I think the line is a lot lower than I was thinking it was going to be. I thought it was going to be higher. I do think there's a difference, but yeah, it's just, I just have to be patient, and I know you guys are all dying to see what the difference is as well. So it'll be interesting to see when the stitches come out, when these steri strips come off even, what it looks like. So I think these steri strips are going to be the biggest bugbear. I think I just want to rip them off now. You know, they're just, I can feel it every time I blink. I can feel it in the corner of my eyes. My eyes are a little bit itchy, by the way. I have to be really, really careful. I get itchy here. What I've been doing when they're itchy is getting a cotton bud and just sort of doing this. And that seems to help a little bit, you know, running it along. Even though I'm not itching the part that's itchy, which is here, it does seem to be helping a little bit. But yeah, I think these steri strips are going to be the most annoying things. And I haven't left the house, and I was thinking, I don't know whether, I was going to say I don't know whether to put sunglasses on. I think I will, because I've been getting some weird looks when I've been opening the door for people delivering parcels. You know, I've got a Colourpop parcel yesterday, which I'm going to do a Colourpop haul at some point. And there's eyeshadows in there that I'm excited to use. So anyway, I shall love you and leave you just now and stop rambling, and I'll see you when there's any changes.